Hi, I'm Michelle Rowland. I'm a clinical social worker and a nurse, and I work at Brattleboro Memorial Hospital. I work in the utilization and care management department. And what that means is I work both with patients and families in a kind of emotional clinical sense, but I also deal with the finances of healthcare.
And Michelle is here today to talk about the American healthcare system and how people can make choices to finance their healthcare.
Wonderful. And I feel very passionately about this topic. I've spent my 30 years as a career in healthcare.
So, I'm from Sweden, and in Sweden we have a free healthcare system financed by taxes. Can you tell me how it works in the US?
It couldn't be more different. In the United States today, we have the highest expenditure gross national product of any industrialized nation. We have one of the lowest levels of public health measures. You know, we are rating 21st in infant mortality and 20th in life expectancy, despite spending the most money on healthcare. And so you'd ask, why is that? Where is all that money going?
Is that fair?
Is it fair? We don't cover every person in the United States. Almost 17% of people in the United States, U.S. citizens, do not have health care insurance. It's an enormous cost to the country. So what happens? The cost is shifted because people are coming into the emergency room and coming into the hospital and not paying for their care. What happens is people are paying, the private insurers must make up that difference. And as a result, costs are just going through the roof. We're also spending lots of money in prolonging patients' life and then in people using the emergency room when they don't really need to. And I brought some numbers from Brattleboro. You know, when people go in and they have a stomach ache, you think, you know, going to the emergency room with a stomach ache? Believe it or not, out of our 12,000 visits last year, which is what we had in the emergency room at Brattleboro, almost 5% were for stomach aches. And you know, we have a medical term for it, it's dyspepsia. It sounds fancy, but believe it or not, it can cost you $5,000 to go to the emergency room for a stomach ache. Because when you go in with a stomach ache, we've got to go do some x-rays, we might do a CAT scan, we might have a specialist come and see you, and that money all adds up, and it can be up to $5,000. Somebody goes in with an earache, that can cost you between $2,000 and $3,000. Because again, we'll have a specialist see you, we might do some specialized test. People might go in with dental pain, which is a very common reason people go in because they don't have dental insurance, and that can cost, you know, $2,000 to $3,000. So when you're looking at these numbers, we each can make personal choices that can make a difference in the expenditures in the United States today. Misuse of the emergency room is the one thing that people can do of all ages. And when I'm quoting those numbers, it's important to remember that that's a bill that you've now incurred. When you go in and you're, you know, termed a self-pay, the expectation of the hospital is that you will pay that bill. It's not free care. Unlike Sweden, unlike a lot of European nations, we don't have free care. So that bill will follow you and would show up as bad debt. So, you know, when you come in, you'll be billed within 30 days. They're expecting that you make some payment plan. And the hospital would work with you in getting that bill paid. But if it's not paid, it can follow you. It will affect you maybe getting a school loan or getting a car loan. So it's something to really be considered that you're going to use the emergency room only when you really need it. So I think we could all make reasonable choices in looking at prevention. And at the risk of sounding like somebody's mom, the way you prevent needing to go to the emergency room is making regular visits with your primary care doc. Pick a doctor, a nurse practitioner, and see that person once a year for a regular checkup. And that's going to cost you a lot less than that $5,000 bill I just talked about in the emergency room. And it's the usual. It's, you know, eating a balanced diet, regularly exercising, making good choices around not using, you know, street drugs or alcohol. Sexual, I don't know if I could talk about that. Sexual irresponsibility is also an aspect that people need to be aware of. To, you know, abstinence or to make choices around careful choice of a sexual partner and being responsible around that. Those are all things that you can do to prevent the misuse of an emergency room. And then by virtue of that, these uncontrolled costs. Brattleboro last year, we just did some numbers. More than 10% of our presentations to the emergency room were for uninsured people. And of those uninsured people, when we looked at just all healthcare visits in the emergency department, we were pretty consistent with the national figures. They're saying that on average, 30% of all healthcare expenditures and a little bit more of emergency department visits are unnecessary. So if you look at 12,000 visits, and of those 12,000 visits, almost 4,000 were really, could have waited, not really an emergency. That's a lot of money and a lot of bills that were incurred. So that's just another thing to think about, is that there's a real way that you should use the emergency room, and then to have the emergency room available for your friends or family members that may need to use it. Not you, when all your family is in Sweden. Well, this was just an overview, and I hopefully hit on some really important topics, and I'm really encouraging people to do more research, because it is something that affects every one of us. Thanks for having me here today.
Thanks for enlightening me about the American healthcare system.